Today, I'm inviting you to explore with me some practical strategies and techniques that you can use to give your patients the best possible experience, protect your income, improve outcomes, and also increase the amount of enjoyment and pleasure that you should be getting from being doctors.
Dr. Bob Baker practiced internal medicine and gastroenterology in Long Island, New York for the past 35 years. He attended Princeton University and got his MD from the Columbia College of Physicians and Surgeons. He trained at Weill Cornell Medical Center and did his GI fellowship at Harvard's Beth Israel Hospital in Boston. Dr. Baker has a special interest in the doctor-patient relationship and served as a physician master facilitator for the Culture of Care initiative of Northwell Health, one of the country's largest health systems. He is the author of The Performance of Medicine: Techniques from the Stage to Optimize the Patient Experience and Restore the Joy of Practicing Medicine. Dr. Baker is also a professional magician and ventriloquist and has appeared on America's Got Talent. Maybe, just maybe, we'll see some of those skills today. In addition to all this, he has managed to be the father of 7 children. Ladies and gentlemen, a very busy man, Dr. Bob Baker.
Thank you very much. I found a way to love practicing medicine again by putting the emphasis on the patient experience. What I'd like to concentrate on is that part of the patient experience that we can control. What happens when the patient is in the room with us? That's where we have control over what happens. Now, research shows that there are 3 things that patients most want from us when they see us. Number 1, they want us to know them. Number 2, they want us to listen to them and respect them. And number 3, they want us to give them enough time. So I'm going to suggest 3 things to do before you go into the room, 3 actions to take while you're in the room, and then 3 things to do after you leave the patient to meet those needs that they have. So now, we are in the room with the patient, and there are some days when we are very energized or very caffeinated, and we stand while we talk to the patient. And then there are those days, particularly towards the end of the days, when we just need to sit down. Well, here's the good news. Sitting is better. Remember, we said that patients want us to give them enough time, but how do we do that when we don't have more time to give? Researchers at the University of Kansas did a study where they sent doctors to the bedside and randomly had them either sit or stand when talking to the patients. And then afterwards, they asked the patients to estimate how much time the doctors had spent with them. The patients consistently overestimated the amount of time that the sitting doctors spent by 40%, even though the doctors who sat actually clocked less time than the doctors who stood. So just by sitting, you give the perception that you're spending more time. You know, as a magician, I love this. This is evidence-based magic. So we're going to sit while we talk with the patient. That's tip number 1.
Outstanding, moving, compelling, yet practical.
Remember, I also said that patients want us to listen to them. And here are 2 ways to show them that we truly are. This comes from the work of the body language folks. When you go into the room, don't sit down and start pecking away at the computer. Make eye contact with the patient. It's best to look at the patient between the eyes and the mouth. This conveys active, friendly listening. If you look at the patient between the eyes and the forehead, that's called power gazing. Many people see that to be threatening. So you want to look at the patient between the eyes and the mouth. Now, it's very important that you not look at the patient in the eyes 100% of the time, because that gets a little creepy.
The presentation was informative, relevant, full of real-world experience, and most of all, fun.
So tip number 2, make eye contact. And the third thing to do in the room in order to show the patient that we're really listening is called the triple nod. By nodding your head 3 times as you talk to the patient, that conveys active, engaged listening. If you tilt your head to the side a little bit as you do it, that conveys empathy. I know that you're empathic, you know that you're empathic, but how do we show the patients that we are? By doing the triple nod. So, the 3 things to do while you're in the room with the patient are, number 1, sit in order to convey the impression that you're spending more time. Number 2, make good eye contact with the patient, 60 to 70% of the time. And number 3, do the triple nod. This is how performance technique creates authentic behavior. Well, today, we're going to add the elements to raise your performance from unconscious to purposeful to 5-star patient experience. I've invited a friend to join me today to play the role of the patient. Her name is Mrs. Lucille Goldman. She's right here. So Lucille and I are going to stage a typical doctor visit, and as we do that, I'd like you please to count how many things you see me do wrong.
And knowing you, there'll be plenty.
Thank you very much. I appreciate your confidence.
Don't mention it.
Things which, if I did them better, would give her a better patient experience. Are you ready?
Sure.
Are you ready to go?
I'm ready.
Good.
What are you doing?
Oh, I'm just checking you into the computer.
Really?
Yes. So good morning, ma'am. How are you today?
Well, how do you think I am? I'm in a doctor's office.
What can I do for you?
Well, doctor, every time I eat something, I feel like stuff is coming up into my throat. I feel like,
Oh, have you vomited?
no.
Had diarrhea?
No.
Abdominal pain?
No. Blood in the stool? No. Can I go on?
Yes, of course, sure.
So I feel like stuff is coming up in my throat, and it doesn't taste very good.
Oh, I think that you need an endoscopy.
Are you kidding me? We did one a month ago.
Oh, we did? And what did that show?
You said it was something called GERD, whatever the heck that is.
I see. Well, all right, let's take a look at you. Now, you probably saw me do at least 4 or 5 things wrong there.
I counted 11.
I wrote that. It was just 5.
I lived it. It was 11.
Well, be that as it may, we're going to discuss some of those things a little bit later on. Quick question for you. Do you mind waiting for me and I'll come back to you later?
Really? Do I have a choice?
Not really.
Don't take too long.
All right. I'll be back very soon.
You doctors always say that.
He used the most effective techniques I've ever seen by a speaker. His message was clear and memorable.
Good performance is authentic behavior in a manufactured environment. It's easier to act our way into a new way of thinking than to think our way into a new way of acting. There are 4 basic performance techniques that we can use to enhance our authentic behavior when we see patients. Number 1, listening and observing. Number 2, responding in the moment. Number 3, staying in character. And number 4, acting as if. Many actors will tell you that when they put in their costume, they feel as if they're becoming the character themselves. Well, for us it's similar, because when we put on our white coat or our scrubs or we hang that stethoscope around our necks, we're putting on our costume. And the character that we're becoming is our doctor selves, which is different from our parents' selves or our soccer coach selves or our going out to dinner with friends selves. Our doctor selves need to be the biggest, best version of ourselves that we can be, no matter what's going on, regardless of whether the EHR has crashed again, or 3 staff have called in sick, or we're running late for grand rounds. Because our patients don't know any of those things. Frankly, they probably don't care. They only care that we give them the best of ourselves for the time that we're with them, our best performance. Thank you all very, very much.